Good evening, dear viewers. I'm Gowri here with you. Welcome to 21st episode of BMC Global Live Al Hilal Health World. Before we get on with the topic, please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel. Sports is something which we all enjoy playing as well as watching, and hence the term sports injuries is very common to all of us. Either we have experienced these injuries ourselves or we have been with someone who have sustained these injuries. So today, to understand more about this sports injuries and ways to prevent them, we have an orthopedic surgeon with 13 years of work experience, Dr. Prakash Kurtakoti. He is currently working at Al Hilal Hospital, Morak. He has been in Bahrain for 3 years. He has done his post-graduation from Karnataka. He has fellowship in joint replacement surgery from Sparsh Hospital, Bangalore and Krankenhaus Hospital, Germany. He is also trained in keyhole surgeries and has performed knee replacement and keyhole surgeries in Bahrain. So, hi doctor, welcome to the show. I hope you're doing good today.
Yeah, I'm doing good. Thanks, Gowri, for having me in this show.
Yes, doctor. So, welcome once again. So, doctor, we'll be starting with the most basic question as to what is sports injuries. Could you please elaborate that?
Sure, I'll be happy to do that. Sports injury in a general sense or in a pure medical terms means these are the injuries which a person sustains it when he is either engaged in the sports or he is getting a training to do so. The injuries that happen during this course, they are referred to as the sports injuries. But in a common practice, it is not specifically that these injuries happen only during the sports. Even the activities of daily life also one can sustain these injuries. Like the common thing that you have, must have heard of, like an ankle sprain, where somebody is walking and tripped and fell down. In a pure sense, it may not be a sports injury, but the sports injury will cover all of these injuries.
So, doctor, for a common man to understand, what are the structures or tissues that are affected during these injuries?
Yeah, it's a good question, and it's good to be clarified in detail so that people can understand what it is, because now people are aware cardiologist will deal with the heart, and a neurologist will deal with brain and nerve tissues. So like that, a sports injury or a sports medicine will basically deal with bones, muscles, tendons and ligaments, all these structures. I would like to talk a few words in detail of all of these structures because in detail they may not be knowing these things. So let me clarify regarding the structures which generally get involved in a sports injury because the different components of musculoskeletal system, that is bone, muscle, ligament, tendon, they all are involved, and the injury, when it happens to any one of them, it will come into the category of a sports injury. Let me tell in a little bit detail about each of them. Now, bone is very common, people are aware of it. How does it get injured in a sports? Is obviously if you are playing sports and you fall down and a fracture happens, that also will include, or sometimes a harsh throw from the somebody is playing a cricket and they throw very harshly, and there can be avulsion fractures in the shoulder where a small bone is chipped off. Even that is also a fracture. It's very typical of a sports injury. And a stress fracture, like somebody who is too much into running, like a marathon or a sprinting, and especially if they're walking on a hard surface, then they can sustain fractures in the foot bones. These are also categorized as sports injuries. Coming to the next one, muscle. People also are quite aware of what a muscle is. Now, if somebody doesn't warm up adequately or had a sudden muscle catch, these also come into the sports injuries. The third structure is a tendon. Many of us may have heard about it, but I would like to tell a few words about it. Basically what happens is all the muscles, they have two attachments. One attachment is in a bulk, it will attach to a bone, but as it comes down, it narrows down, thins down and becomes like a rope. And this rope goes and fixed to one particular point on the bone. So when a muscle pulls, it will pull this rope and it will pull the bone, and that's how the movement happens in that line. So this particular structure which transforms from the muscle and to become a rope, that's called as a tendon. So people can snap this or rupture this or tear this also when they are doing the sports. So, quite commonly this tendon injuries are common around the shoulder. People who have playing sports like tennis or even cricket, they can snap these biceps tendons. And coming to the last category, that is the ligaments. So, ligaments are not like tendons. Tendons, the main thing is they have a very elastic nature, but the ligaments are not, they do not have so much of elastic nature. The main function of the ligaments is they will try to give stability for the joints. Okay. Now, any joint, to define what a joint is, basically when two bones meet and they move in one particular plane. If it has to move in that particular predefined plane, it can shake or move or go in either direction, but it should not happen. As by the nature of the design, it has to move in one particular plane. If it has to do that, then all the ligaments which are there, they will give the stability so that the bones will move in that plane. So, the basic function of a ligament is to give stability for a joint. They are present in all the joints in the body. So, if you injure that also, it also comes under the sports injury category. The very common one which you must have heard of is an ankle sprain. Yeah. When the doctor tells about an ankle sprain, what he is trying to tell you is that the ligament which are supporting the ankle have been injured. So, this when he is telling, he is referring to that particular structure in a broad sense of a musculoskeletal injury. Okay. Yeah, I hope I have clarified the basic things which are covered in the sports injury.
Okay, doctor. So yes, you had covered a lot about the structures. So what are the common type of sports injuries that a patient comes in with?
So even the sports injury can involve any joint or any part of the body. Quite commonly what we see are mainly around the ankle, okay, the knee joint, and the shoulder, yes, muscle pulls, tennis elbows. These are some of the common injuries that we encounter in the day-to-day clinical practice. Now, the sports injury is gaining importance now, is for the reason that we are started to see these knee injuries more often these days. In our daily routine, we have seen that we are more frequently seeing these sports injuries in our clinical practice. The numbers are definitely higher than what we used to see when we were trainees, that was around 20 years ago. Now, the reason for this is, apart from a few exceptions of the Western countries, most of the countries have the younger population in a higher percentage in a population, yes, and that will give them more mobility, and they are involved more in the sports. Plus, the awareness also is more towards the health. So, more often people are going in for walking, jogging, training, gym or treadmill. So, all these are making them more prone for the sports injuries, and that is also one of the reasons why that we are seeing more often the sports injuries in these times. Okay. So, in this regard, when they get involved in these things, then they land up in ankle sprains, or muscle pulls, muscle spasms, or shoulder injuries, or a tennis elbow, where they mainly people who play tennis or the badminton, quite often we see these are the common injuries that we see more often in the practice. One particular thing specific for the Middle East, of course worldwide, but more specifically is the knee injuries. And the reason for this is, like unlike in India where cricket is the love of the nation, for the Middle East it is the football. Yes. So, you will find people of all ages, both men and women, all of them are they love the sports, and they go out to play, and that is why they become more prone for the knee injuries. And this is the reason why in our clinical practice here, the significant of them come with a particular knee sports injuries.
So, what are the common symptoms that a patient comes in with when they have these sports injuries?
In a wide spectrum, but specifically each joint behaves a little bit differently, but commonly the symptoms that a person experiences when he is injured in a sports, it will be the first thing will be the pain, of course, an excruciating pain followed by swelling, and pain on walking, and they can't move the joint, it will be very painful. Sometimes if the injury is a little bit more, then the bleeding underneath the skin will cause skin bruising. These are all the very common symptoms one can expect in a sports injury. Apart from this, there are some specific symptoms which are very specific for one particular joint. For example, for the knee, they may additionally have symptoms like locking or instability. Yeah, these are specific for one particular joint. But generally speaking, pain, swelling, bruising, limping, these are the common symptoms in a sports injury.
So doctor, as you had mentioned, these days knee injuries as well as ankle sprains are very common. So could you please tell us more about them, like as in what the patient should expect when they come to visit an orthopedic with such injuries?
Yeah, I would like to discuss two common injuries that we see in the practice. We can't cover a lot of them. So we'll begin with the most common, that is the ankle sprain. So it's very common. We have heard people, and either one of us or one of us in the family, very commonly would have injured the ankle. Usually, what happens is when a person misses his or her step, and the ankle deviates in a very wrong way, then it will pull the ligament and will cause the injury. Now, when such a patient walks into the doctor's consultation room, usually what they can expect is the doctor is going to ask you a few questions to know how the injury has happened. Why this is important is he is trying to understand the mechanism of how it happened. If he understands that, he can by the history can get a clue of what particular structure is injured. Once asking the questions, then he will be doing some examination and some test on the affected part, like the ankle, to find out which particular ligament, because it is not like one ligament which supports the ankle. There are a lot of them. So he will have to pinpoint or try to get a broad sense of which particular ligament is injured. Once he's done that, in most of the cases, if required, he will be asking for a very basic screening investigations like an X-ray. So basically, the doctor will be asking for the X-ray mainly to make sure that the bone is not injured, and sometimes some special X-rays, something called as a stress views. So these are the basic things that once an ankle injury happens, this is how it flows.
So doctor, how are these ankle injuries treated?
Well, the ankle injuries, there are different grades of ankle injuries depending on the severity. Now, the ankle sprain where somebody twisted the ankle and fell from a standing height, like for example, that somebody is walking and tripped and fell down. The force and which goes through this one is different from a person who is actually running behind a ball, chasing in the football, and he twists and he falls. The amount of force is very different, and that's why the structures and the severity with which he injures in both these patients will also differ, and that's why the treatment also will differ. So once the ankle injury is diagnosed by your orthopedic surgeon, he is going to grade it and see whether it is a very mild problem or a moderate problem or a severe problem. Now, fortunately, even though the ankle injuries are common, 90% of them will fall into either mild or moderate. Why it is important is because all of this mild and moderate, they can be treated in a conservative way. What I mean by conservative way is non-operative. It does not need surgery. Only a small percentage of them which are very high grade sprains, in them they will go in for the different surgeries. The common treatment modalities, treatment options which the doctor is going to give you in majority of the cases will be painkillers to reduce the pain, and then he will be advising you to elevate the limb so that the swelling which happens because of the injury will reduce. He will be advising you to put a lot of ice, that will also help in reducing the pain and the swelling. And if the doctor feels that the injury is a bit more and the symptoms are a bit more severe, he may also advise you for going in for a plaster. For some patients it may not convince them, they may also be surprised, but they should be aware that the doctors will be advising them the plaster if they feel it is required, even though there is no bony injury. It is a common understanding that it is only put for the fractures, but if the sprains or the ankle injuries are a bit more severe, in that case the doctor will be advising the plaster even in such cases. Regard to the small percentage of the patients where unfortunately the injury has been diagnosed with an MRI saying that it's a severe grade of injury, in that case, in those small percentage of cases, the treatment will be mainly surgery. By either open technique or by arthroscopy, the torn ligaments will be either repaired or will be replaced by the new ligaments.
So dear viewers, now we'll be going for a break. We'll be back soon. Please do not forget to like and share our Facebook page. Also like, share and subscribe our YouTube channel.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain, with over a decade of existence in Bahrain. Exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909-6845, 3909-4806, 3885-2397, or visit www.bahrainmediacity.com.
വിഷമിക്കണ്ട, എല്ലാം ശരിയാവും. ലുലു മണി, സ്നേഹപൂർവ്വം.
വർണ്ണവസ്ത്രങ്ങളുടെ കമനീയ ശേഖരവുമായി വനിതാ ടെക്സ്റ്റൈൽസ് ബഹ്റിൻ ഇന്ത്യൻ ക്ലബിന് മുൻവശം പ്രവർത്തനം ആരംഭിച്ചിരിക്കുന്നു. വനിതകൾക്ക് മാത്രമല്ല, കുഞ്ഞുങ്ങൾ മുതൽ മുതിർന്നവർ വരെയുള്ള സ്ത്രീ പുരുഷ വസ്ത്രസങ്കല്പങ്ങൾക്ക് അനുയോജ്യമായ വൈവിധ്യ ശേഖരവും വനിതയുടെ പ്രത്യേകതയാണ്. ഇന്ന് തന്നെ സന്ദർശിക്കൂ വനിതാ ടെക്സ്റ്റൈൽസ് ആൻഡ് റെഡിമെയ്ഡ്സ് ബഹ്റിൻ ഇന്ത്യൻ ക്ലബിന് മുൻവശം. വി ഹാവ് ഗോട്ട് ഫാഷൻ ഫോർ എവരി വൺ. വനിതാ ടെക്സ്റ്റൈൽസ് ആൻഡ് റെഡിമെയ്ഡ്സ്.
Welcome back dear viewers, you're watching BMC Global Live Al Hilal Health World. We have Dr Prakash here with us. We had talked about the treatment of ankle sprains. Now we'll be talking about knee injuries. So doctor, what are the common symptoms that they come in with for knee injuries?
As I've discussed earlier, even these patients come with the common symptoms of ligament injury.
Yeah.
Basically, it will be pain, swelling,
Yes.
and if they try to move the knee joint, it will be very painful,
Yes.
and limping. These are very common symptoms, and it happens here also.
Yeah.
But some specific symptoms are special for the knee. One is called as a locking, another one is the instability.
Okay.
Now, let me give a brief anatomy so that the viewers can understand.
Yeah.
Now, this is the model of the knee. Now, if we look inside the knee, now what you're looking at is the femur bone and the tibia, and these are the supporting ligaments from the outside,
Okay.
and the one you can see in the front is called as the ACL or the anterior cruciate ligament, and there's a similar ligament on the back that's called as the PCL.
Okay.
And the ones which are like, you can see two C-shaped structures here,
Yes.
and these are called as the meniscus.
Okay.
Now, if these meniscus, they basically act as a shock absorber, and if they get torn, the consistency of this is somewhat like a rubber.
Okay.
Once it gets damaged, it can get stuck between the two bones, and they start experiencing locking. Now, what happens is these patients will not be able to make the knee straight.
Oh, okay.
So they have to walk on a bent knee, and it will be quite painful. This is a specific symptom which suggests that there may be the injury of the meniscus.
Oh, okay.
And as far as the ligaments are concerned, like I've already discussed, these mainly give the stability for the knee when the knee is moving. so that it doesn't allow to shake.
Yeah.
Now, if these ligaments get cut, then the patient will start experiencing something called as an instability. What we mean by an instability is when they try to put the foot and walk, they feel that the knee is wobbly, it is shaking.
Oh, okay.
This will make them lose a loss of confidence, especially in a normal walk. They may not have so much of difficulty, but when they are trying to walk down the stairs quickly, or they want to take a leap or a jump or a stride, or they want to run, in all these scenarios, when they land on the injured leg, they will not feel stable, they will not feel safe.
Okay.
They will feel that they may fall. This is an instability symptom. If that is there, then most likely that patient
Yes.
is experiencing with one of the ligament tears.
Okay. So doctor, yes, we understood that these are the common symptoms, and so how is it diagnosed and how is it treated, these knee injuries?
Yeah. The common protocols which I have described for the ankle injuries, most of them hold good here also. It starts with the doctor. He's going to go to the history, try to understand the mechanism. He's going to do some special tests on the knee joint to get some clue of what part of the knee is injured, and then it will again next go to the basic investigation tools of an X-ray to see if any bony injury is there.
Yeah.
Once this is done, there are two options at the end of the first visit of a knee injury to the doctor. Now, if it's a very obvious injury, then the doctor may straight away advise to go ahead with an MRI investigation.
Okay.
It's not mandatory, but if it is very obvious, he may advise that. But in most of the cases, when the patient walks in for the first time, we generally give some more time for this pain and symptoms to get reduced.
Okay.
So he's going to treat it with medications and may also call you back after 2 or 3 weeks time, again recheck, and at that time also if he suspects that there's a ligament injury is there inside, then he will advise you MRI at that juncture. So either way, the MRI is the main diagnostic tool to confirm that there's a ligament or a meniscal injury within the knee joint.
Yeah.
This is how a doctor is going to diagnose the knee sports injuries.
Okay.
Coming to the treatment part, compared to the ankle injuries, which I told you, even though ankle injuries are common, majority of them are managed without any surgery.
Yeah.
But that is not the situation in the knee injuries.
Oh, okay.
So here, at least 50% of them will need a surgical intervention.
Oh.
They are not as common as ankle, but when they happen, at least in 50% of the cases, they may end up needing a surgical intervention.
Okay.
So the basic thing is, once the doctor has diagnosed, if he thinks the injuries are not critical, then he's going to again advise you for the rest, ice packs, limb elevation, medicines for the pain, and in some cases even plaster as well. But if the very critical structures which I've explained, like an ACL is torn, or a PCL is torn, or a meniscus is torn, or cruciate ligaments are torn in a very high grade, in these circumstances, there's no option to treat them but with surgery. Surgery becomes necessary, especially in a younger patients.
Okay.
These are all what I'm explaining are in the general sense, but a lot of other things also go into consideration when the doctor is going to advise, because they're going to consider the age, they're going to consider is the patient is having other medical conditions, they're going to again consider the level of activity, they're going to consider what the patient wants. Depending on all these things, then the doctor is going to advise the treatment. Remember, because even with an ACL injury, the patient can still walk. That's not a problem. The problem comes only when he wants to run or jump, or he wants to go back to the sports. So in these situations, it becomes necessary that surgery is the only way. Now, there are different surgeries which have been described for the knee injuries, and most of these can be performed by keyhole surgery.
Okay. So doctor, what is keyhole surgery?
A keyhole surgery, the medical name for this is arthroscopy.
Okay.
The basic principle is there is a specially designed camera in a small tube, which may be 4 to 6 millimeters, which is with a small cuts. It is put into the knee joint. It has a camera attached and also has a light source, so that we can see inside when it is connected to the monitor.
Okay.
So this is a keyhole surgery in a broad sense. Now, what are the advantages? Why do we have to do a keyhole surgery, not a regular one?
Yeah.
Now, 2 to 3 decades back, when it was not in a common practice, the sports injuries were dealt with by open procedure.
Yeah.
By open procedure, what used to happen was they would open up the knee from top to bottom and then repair it. Now, by doing so, the cut is very big,
Yeah.
and the pain which comes for the patient also will be big,
Oh, okay.
and the chances of infection are more. Chances of blood loss, how much blood loss? Definitely blood loss will be much higher in open procedure.
Yeah.
Plus rehabilitation, how quickly they can go back to their regular life, that is also is prolonged. Now, with the advent of keyhole surgery, it has made a remarkable improvement in these things, because even though the procedure which we do inside is complex, from outside it is only an inch of stab incisions or small incisions, 2 of them. From the outside only they are there. By doing that, the pain is much less, the swelling is much less, the stiffness in the knee joint is much less, infection chances are much lesser,
Yeah.
blood loss is very minimal, almost to the extent of nil,
Okay.
and then the rehab is also much quicker, so that it becomes easy for them to go back to their daily life.
Daily life,
In
yeah.
fact, in many of the centers abroad where they have the issues of the insurance, most of these are done as a daycare surgery. A daycare means they come in the morning, do the surgery, and be back in home by the same night.
Yeah.
That is the advantage of a keyhole surgery. So most of the knee surgeries, ligament injuries, meniscal injuries, osteochondral fractures, all of them can be treated, more than 90% of them can be treated by the keyhole surgeries. Only select few of them still need open surgeries.
Surgeries. Okay, so doctor, when a person sustains these injuries, the sports injuries, what are the do's and don'ts of these sports injuries?
Well, the first thing is they have to stay calm, because when they're injured, the first thing comes to is really very bad happened.
Yeah.
That will be the first thing. So fear will aggravate the pain. Fear will always aggravate the pain, because the pain and the fear are represented in the cortex.
Okay.
So first stay calm. Next, elevate the leg. If it's going to take some time for you to meet the doctor, find a place, or in your home or in an office, wherever it happens, or in the field, try to elevate it, keep it at a higher level so that the swelling doesn't come. And then you can put ice immediately over that part.
Okay.
Do not massage. The massage will only increase the pain.
Okay.
Yeah. If you have a sprays or a gel, just apply it, but do not massage it. These are the common ones. If you suspect that there is a fracture, then in that case we have to find a hard object to splint it as well. These are the common things that the people can do if unfortunately they sustained a sports injury.
Sports injury. Okay. So doctor, how can these sports injury be prevented?
Well, that's a good question, because now the major advances in the sports injury as well as in the sports physio rehab. This is the upcoming thing where all the effort is being made to prevent the injuries.
Oh, okay.
Because for a professional athlete, especially for the professional athletes, when they injure, getting back to the game becomes a quite prolonged process. For example, when you undergo an ACL surgery, most of them will require at least 6 months to go back to the game.
Okay.
So especially if it's an important player of a big league, then it becomes really difficult.
Yeah.
So all the efforts now, the research is going to prevent these injuries. Now basically this injury prevention is being done by the physiotherapist. Okay. Now I encourage the newer physiotherapists to go on and approach these programs and get trained, so that they can guide the professional athletes or even the sports enthusiasts, or even people who come to the gym. So that this field is basically what it does is they will train them to prevent the injuries by training the different muscles, how to warm up, how to do the stretches, all these common things, and how to train different muscles of different joints. By doing this, there's a remarkable drop in the chances of injury happening in the first place, so that we can eventually avoid all the things which happen after that.
Okay, doctor. So that was all the set of questions I had for you today. So thank you so much for being here with us and taking your time off the busy schedule and being here. Thank you so much.
Thanks, Gowri, and thanks BMC for having me here. I hope I have clarified a few things and hope the viewers will find it useful in their day-to-day life.